Welcome to the Sharing Without Shame podcast, dedicated to parents and anyone else who loves someone in active addiction. Education is a powerful tool in breaking down stigma, fostering understanding, and ultimately helping individuals and their loved ones navigate the challenges of addiction. With Donna Marston, author of Peeling the Onion and Sharing Without Shame. So take a deep breath and grab some tissues as we uncover the stories of love, courage, and unwavering support in the face of adversity, as Donna and her guests share their stories without shame. Because when we share our stories without shame, we inspire others to do the same.
So welcome. Today I'll be talking to Elizabeth Kipp, who is a chronic pain management expert, addiction recovery coach, ancestral clearing practitioner, yoga teacher, and author who is in long-term recovery from chronic pain and concurrent addiction. And Elizabeth helps people find and build a stable recovery path. So welcome, Elizabeth.
Thank you so much, Donna. Thank you for the introduction. I'm grateful to be here and happy for your platform.
Thank you. Thanks. The first question I like to ask is, what would you like to share without shame?
Well, I'd like to share that a few things define chronic pain right up front. Chronic pain is any pain that's felt 15 days out of 30 for 3 months or more. Physical, mental, emotional, spiritual, financial, it all sends the same signal to the brain: it hurts. So the brain can't tell the difference between a broken bone and a broken heart.
That's interesting.
And chronic pain, yes. Chronic pain changes the way the brain processes pain. It creates confusion in the brain, and it throws up chronic stress is a subset of chronic pain. The body actually creates chemicals that are addictive, so you can get very addicted to the frequency, the energetic, the lifestyle of chronic stress and chronic pain. So one of the things that happened to me, and I sat in front of thousands of other chronic pain sufferers over the years because I had it for so long. I was in so many different facilities trying to learn how to deal with it. Is that we become shame-based. The brain is affected in a way that we have a negative bias anyway, when we're healthy. But when we have that chronic pain happening, that negative bias gets accentuated, and you're wrong, I'm wrong, the world's wrong. This negativity can really go off like a runaway train. As I said, that we've got this chemical addiction happening in the brain. It's not like a dopamine reward thing. It's just different. It's just we get used to this habit. And one of the things that happens because of that negative mind is our self-esteem suffers. And we think there's something wrong with us. And we feel shame. What's wrong with me? Why can't I can't heal like other people? What's wrong with me? So this is an issue. Also, people aren't interested. They don't like to be around people that are hurt all the time.
Right.
And so then, that adds another layer of what's wrong with me. My friends don't want to be around me anymore, even though I'm trying to hide this thing that I have. So the first thing that I'd like to talk about is there's no shame in having chronic pain. Chronic pain is a condition. It's a habit that the nervous system gets into. It's a result of a lot of stress load in the nervous system, and we're made to address threats or stress in the environment. We have this thing called a stress response, which when we're under threat or danger or stress, the stress response goes in the on position, then we meet the threat or the stressor, and then it goes back in the off position. But in chronic pain, the stress response gets stuck in the on position. And we're really not made for that. that's very toxic to the body. And as I said, it throws off these chemicals that it's hard to kind of get out of that frequency. So you have to work. You have to work at getting yourself out of that. So that's the first thing. There's no shame in being ill.
Right.
So there's no pain. There's no shame in chronic pain. And I heard a lot of doctors say, and I have a science background and they couldn't get away with this with me, but I heard a lot of doctors say it's all in your head, which is like a shameful thing to say to somebody, because like, how am I supposed to deal with that? Well, I knew kind of a little bit about what was happening. And I said, well, you're darn right, it's in my head. That's where the brain is processing the pain. So they couldn't they couldn't kind of they couldn't just say, oh, it's in your head. They couldn't. That's dismissive. And I don't, that's not helpful. And not all the doctors, but a lot of doctors can say that. I mean, I don't know if they still do that, but that's something that I experienced, and lots of other people that I sat with experienced, and it's a misunderstanding. So there's no shame in having chronic pain. So just like there's no shame in having addiction. It's a disorder in the nervous system. It's a reflection of disconnection and unresolved trauma in the nervous system. Everyone I know that as an addiction recovery coach, I'm in the field, right? Everyone I know is in recovery from addiction was a chronic pain sufferer first, and before that they were carrying unresolved trauma.
Interesting. Because I know, years ago, my boys were diagnosed with ADHD, and I didn't want to medicate them, so I brought them to a chiropractor, and he worked on the nervous system. And I've heard since then that people who have a substance use disorder, if it's about the nervous system, that's what's being affected, and they could go to a chiropractor, possibly. I'm not saying this is a cure or anything like that, and have them work on their nervous system, and that could help them with moving forward or with their addiction. Or does that make sense?
Well, it does. Here's the thing, that with the viewpoint around addiction is it's a dis-ease of disconnection of connection. It's a dis-ease of connection.
Right.
So what's disconnected there? We've suffered trauma. When that happens, we have unresolved trauma. Trauma isn't what Dr. Gabor Mate puts this so beautifully. Trauma isn't what happens to you. It's what happens inside of you because of what happens to you. Mm-hmm. And what happens to you, especially if you're alone with the hurt, which many of us are, we disconnect from ourselves, and we disconnect from others. We can't share it. So we disconnect from others. We feel a disconnection with maybe God or higher power, wherever you want to call that, consciousness, energy. And that certainly happens in the chronic pain experience as well. This disease of disconnection. So it's a mind, body, spirit thing, and chiropractic looks at the body part. And I see chiropractors. I would consider that as part of healing the nervous system, but I would not consider that the be able to end. It would be part of an integrated program.
Right. Yeah.
Around healing addiction. Chiropractic would be part of it. There would be other elements of it.
Yeah.
That I would bring in, certainly at breath work and, physiological, clean the body, make sure that the body's physically detoxed and, properly nourished. Also, there's all kinds of, like I'm a yoga teacher because the yoga has been very helpful in helping me to regulate my nervous system. Yogic practices have been very helpful at helping me regulate my nervous system, because it gets dysregulated. Mm-hmm. So on the stress response on the on position. Anyone that's suffering from addiction has a dysregulation problem in their nervous system. Mm-hmm. So chiropractic can help with that, because the value of a chiropractor is that if there are any structural challenges in there, and I have some, because I've got a broken bone in the base of my spine in the fifth lumbar area, which is now it's got hardware and holding it together, but it's created this kind of a twist in my spine. So that's not normal. So one of my practices is in my yoga practice. Part of my work is to every morning I get up and I work with my spine. I move my spine in 5 different directions and kind of get it reset, because its natural thing is to want to get in this kind of spiral. And I
Mm-hmm.
see a chiropractor. I see a chiropractor once a month, and I can feel the difference. He's able to put some pressure onto my spine in a direction that I can't do it myself. That downward, when I'm lying down, that downward pressure, very precisely positioned. I
Mm-hmm.
can't do that in a yoga practice, but I can do all the other stuff. But the thing is because of my yoga practice, when I go into the chiropractor, he's pretty much only got to touch me and the body just, yes,
Wow.
it knows to move, right? But the idea there is that if there's a block, if the bones are, if the muscles are tight and they're moving the bones in such a way that it's kind of blocking the transmission of the nervous system going the spinal cord going up the spine, then you're not getting, you're getting full signal to all the, wherever that blockage is. You're not getting a full signal there, and that, but not necessarily the listeners. So you're opening up that channel, and now you've got nourishment.
And when I was reading some information about you, um, there was 32 years that you were addicted to prescribed meds. Is that correct?
I was
That,
on, yeah, I was on 32 years. I was on them. Yeah.
oh, so that makes sense. So you were on prescribed meds and you became addicted over time,
Oh,
correct?
yeah. Mm-hmm.
So can you talk about that? Because I don't think people often understand that because a doctor prescribes a medication, that, the body, the mind, whatever, can become addicted to it. And I think it's very common with our seniors. They're highly medicated for their aches and pains. But if you could just address that a little bit, that would be great.
Sure. Some pain medications are addictive and some aren't. So
Mhm.
that's kind of important to kind of, make that distinction. And as I said, that chronic pain can become a habit. So we have to address that at the root level, an integrated program. Medication, they had me on opiates and benzodiazepines, because my reaction to the pain, I had such a hyper reaction to the pain I was feeling, that I was just anxious. And so they gave me that anti-anxiety drug, and both of those opiates and benzodiazepines are addictive. The thing about a doctor and medication now, looking at it from my end now, is before a doctor gives me a new medication, here's my question for them. What's the end game? What's the exit plan off this medication?
Yeah, right.
And have you done it before with your patients? Because my prescribing doctors didn't know how to detox.
Mm-hmm.
And I
Mm-hmm.
didn't know at the time to ask that question, but I ask it now. Not that I'm going on any, I'm just saying, like, for my coaching clients, that's just a thing. I mean, if I sit in front of a doctor and he says, you need to be on this medication, I'm like, well, what's the exit plan? So to know how much this doctor really knows about this medication. And so, I mean, that's not the only question I ask, but that's a very important question.
And how did they respond when you asked them that question?
Well, my prescribing doctor, when I finally asked that question after I'd been on the medication for years, the opiates and the benzos for years, he hadn't ever detoxed anybody off them. And so he said, well, we can put you in a coma. And I
What?
said, well, that's sometimes that is a method. It's not the one I would use, but it's the one that it is used. And I said, and how many patients have you taken through that? And he said, none. And I said, well, I'm not going to be your guinea pig, right? So,
Wow.
so I went to a chemical dependency hospital, a detox center, and went into a pain management program. And before I got into the program per se, which is like a classroom kind of situation, I was in a chemical dependency detox bed for about 12 days,
Mm.
detoxing off the medication. So I went to a facility that actually knew how to detox me off of. And at that point, I had been on fentanyl for 15 years.
Wow.
So yeah, so that was, you're not probably going to run into many people that have been on fentanyl that long and live to tell the tale. So I feel like everybody in recovery is a miracle. I happen to be, I feel like I'm a miracle too.
Oh, I agree. Absolutely. Absolutely.
So the problem with opiates, and we'll take opiates first. I'm not saying that they're not useful. I'm saying that they're useful for acute pain. And there's really no research that says that they help chronic pain. If the nervous system is so wound up, like when I had a kidney stone, died of 4 millimeter size kidney stone, that was pretty wound up, like that, really painful.
Yeah.
I went to the emergency room. They gave me an opiate for that, but that was, for them, for that moment. But if the nervous system so wound up that it can't relax, then an opiate is useful. It's useful. But if you've got chronic pain, there are other ways to get at that. And the problem with an opiate is that it depresses the breath, the respiration. So we're not getting oxygen into the cells and we're not releasing toxins out of the body. So there's that. It dehydrates us. So we're not getting proper water into all of our cells. That's another problem. It paralyzes the gut. So we're not digesting our food. And tell me, how are any of those things healing?
Wow. They don't sound like they are.
No. So this is why it makes sense for the short term, but in the long term, this is not moving us in the healing direction. And so that's the problem with opiates. The problem with the benzodiazepine is that they turned around and gave me the anxiety. I got it worse than I had it before I started them. So I ended up, I was kind of like activated and hyper all the time. But then I ended up getting panic attacks. So it took it to the next level. Wow. So they can turn around and bite us right in the butt and give us what we're taking them for. That's the problem with the benzo when you're on it for too long. And you're not supposed to take them for very long. And I was, a matter of weeks, and I was on it for years. So it was kind of like, and I didn't know about the off-label use. I wasn't informed about I read the little sheet that comes with the medication, but it doesn't tell you things. So it's a little bit deceiving. So these drugs are tricky, and coming off them is also tricky, and tricky enough so that you need a medical assistant. You can't just decide, well, I'm not going to do that anymore. You can get seizures and have all kinds of problems. So
yeah.
You need a medically. So this is why I say, if a doctor's going to put you on a medication, find out what the exit plan is, and do they know how to execute it?
Thank you for sharing that, because I think that's really important, because doctors are taught pain management, right? That's what they do. It's pain management.
What kind of pain management? What kind of pain management are they taught? Because the Western medical model is very good at trauma, physical trauma. They know how to handle that. They can stop the bleeding, they can stitch you up, all that kind of stuff. But the chronic stuff, that's not where the Western medical model is really pointed at. That's not really what their training is about. So you're talking about a chronic situation, and their pain management is getting better, it's becoming more integrated. But pain management for me, when it was my deal, I was working with a pain management doctor, a bunch of different pain management doctors, and they were all giving me opiates and benzos. That was their answer.
Yeah.
And they were doing, of course, obviously I have this back problem, so they were giving me chiropractic adjustments, but that wasn't solving the problem, because the problem was deeper than that. The brain processes things differently. It's not about my back at that point. So here's the thing that's interesting. And it points to a limitation in the Western medical model. If you saw 3 different patients that all have x-rays like mine, with this break and slip in the fifth lumbar that's got hardware in it, holding it together, you'd see 3 different kinds of patients. You'd see one that had pain all the time. Mm-hmm. You'd see another that only had pain when they were stressed. And you'd see another one that doesn't have any pain at all. How do you explain that just looking at the x-ray?
Not a clue.
You can't. Yeah. And I've
Yeah.
been all three of those patients in my life. I've actually been all three. I've experienced all three of those states. At this point, I'm the one that doesn't, it doesn't matter kind of what's going on. I don't have pain, just a blessing. So, but I used to have pain all the time. And then I went to a place where I was like, oh, I only have pain when I'm stressed. And then I went to like, yeah, I can be stressed and I don't have this pain anymore. Well, that's not about the x-ray and the back. That's about, or the chiropractor. That's, the chiropractor is helpful, but it's not about that. It's about retraining the brain, retraining the nervous system, not just the way the bones are in the spine, but actually retraining how are we handling, what are we bringing to the table around our pain, and what am I doing to contribute to the pain? That was one of the things that blew me away. I, for years, was thought, like, because of what the doctor said and stuff, I thought the pain was doing it to me. And then I went into that pain management program, and he wrote this beautiful book, Dr. Peter Prescott. He wrote this beautiful book, Conquer Chronic Pain, an Innovative Mind-Body Approach. And he died in 2016, but he left us this beautiful book. And when I got in his classroom, he detoxed me off the medication in one of his 12 days in this detox bed. And then they kind of poured me into a wheelchair and wheeled me into his a classroom, and there's 20 other people pretty much just like me. And he said, and one of the first things out of his mouth was, don't judge the moment. And I thought, I'm just sitting here minding my own business. I'm not judging anything,
Right. Yeah.
Did you notice that attitude? I didn't say it out loud. It's what I thought in my mind. But did you notice the attitude? I'm feisty. Don't mess with me.
Defensive.
Yeah, very defensive, right?
Yeah.
So just notice that. Then he says, I couldn't believe he said this, in that, with my mindset in that space. He says, what are you doing to contribute to your pain? And I was like shocked, because I thought, he's sitting here in a room full of people that are all chronic pain sufferers. And, my perspective was, it's doing it to me. And I figured everybody else felt that way, because every other patient I ever sat in front of that was a chronic pain sufferer felt the same way. And I thought to myself, he's asking, he's asking for trouble asking that question in this room. and because, talking about defensive, I was just like, what are you talking about? But he had the room, and I knew he knew more than I did, and about, pain. I mean, I hadn't experienced it, but he understood the science of it, right? He understood the body, the mind, spirit system thing. When I realized, when he asked that question, I had this aha moment. Note the question: what are you doing to contribute to your pain? Well, I thought the pain was doing it to me. So I walked into that room feeling completely disempowered. But he asked that question. And the assumption in that question is that I actually have some power to affect my pain experience. And so he took me, just from asking the question, he took me from victim to empowered patient.
Wow.
Just by the question.
Wow.
Right. And then we had a conversation about, within the class, we had a conversation about the things that we were doing to bring, that were contributing to our pain. And one of them was judging the moment. How is that? Judging the moment is bad. Pain is bad. Not pain is information, which is neutral. That pain is good, which is masochistic. Pain is bad.
Yeah.
Now we've got a problem, because we've got a sensation in the body, and we've got the mind saying, oh my God, we've got a reaction coming in from the mind. And then you've got a problem. So he took us in that program from feeling that pain is bad. It shifted our mindset into pain is information.
Interesting.
Yeah. And I walked into that, and I wasn't the only one. I walked into that program with 40 years of chronic pain. That's quite a habit.
Yeah.
And I walked out 52 days later with no pain.
Wow.
I know. And it wasn't just me. He had a 94% success rate in that program.
Wow.
Yeah. So you talk about pain management. We have to look at pain management from an integrated point of view, where you're looking at the mind, body, and spirit all at once, because they're all affected. It's not just about the back or whatever the physical problem is, the hip, the headache, whatever the thing is. It's about mindset. It's about the spirit. Like we talked about chronic pain being a self-esteem issue, right?
Mm-hmm. Yep.
That's spiritual.
Yeah.
Right? So there's a lot going on there, a disconnection, disconnected from God. Where's God? God's punishing me. Whatever the thing is, we've got this twisted, a misunderstanding about our relationship with the world on all these different levels. So a pain management today that would be effective, that I experienced, and it's out there. You just kind of have to look for it. Is this integrated program where it looks at mind, body, spirit all together? Is that your experience that with your son?
My son, he went to treatment. He went to he was in and out of treatment facilities. He didn't deal with any type of meds. He was, street drugs was what he was.
Well, drugs are drugs. Yeah, a habit's a habit. Yeah.
But I will say this, which is interesting. So when he finally decided, or not that he decided, but he had a spiritual awakening. It's when everything shifted. And it's interesting because I said, what was different this time? Because he was in and out of treatment facilities. And he took my book. I was reading this book, You Can Heal Your Life by Louise Hay.
Mm-hmm.
He loved that book. And I had the movie. And the movie's all about insecurities. Well, how we self-sabotage ourselves. Mm-hmm. And it's funny because I always fell asleep. I could never watch the whole movie. And he loved this movie. And every night that he was home, he would go up in his room and watch this movie. So when he was going to treatment, he really went to get me off his back. It was a horrible day. Everything about the day went terrible. And he went and got high. And, I said some stuff that I shouldn't have said, and, all in the moment. And then when he came home, I had said, I can't do this anymore. I love you. I hope you'll get help. And he decided to do that. And when he went to treatment, he brought the book, Louise Hay, and the movie with him. And there was just one day that he looked at himself, who was the person who used drugs, and this other person was there. And he said that he felt a negative energy leave his body that night. He felt that he had a spiritual awakening, and he knew he was going to be okay. But he had a conversation with the person who uses drugs and the person who was working on getting sober. And so every day he started writing positive affirmations. So before he went to bed, he'd write positive affirmations. And in the morning, he put his mattress on the floor so he could roll right to his knees. And he would pray. At the time, he called his higher powered dude. That's how he got through it. And he would do that mantra all day long. And that's how my son worked his recovery program, which brings you to, when it's mind, body, and soul, that's a holistic approach to recovery, correct?
Absolutely. Yeah, absolutely.
Yeah. So he incorporated that. Mm-hmm. And, and it's interesting because I didn't know if he was going to come home. So I had taken his room and I made it this spiritual room because I had started my own spiritual journey 2 years prior. I had hit my enough, and I just needed to find a different path because I was so emotionally sick from trying to rescue him. And so I turned this room into a spiritual room, and then he came home and he took it back. And I said, I'll take, I had painted faith and different stuff on the walls. I said, I'll take all that down. I'll put it back to Nomi. He goes, no, Mom, please just leave it.
Awesome. I love this story.
Yeah.
Right. That's so awesome. You both aligned with your, you had both had a spiritual awakening and aligned, together. That's just a beautiful story. I love that.
Thank you. Yeah. And it's pretty amazing that, I started 2 years before he did. because, like I said, I hit my enough. And then when he told me his story of his why, because it's all about our why.
Mhm.
Why do we do what we do?
Mhm.
And his why was he just something shifted. He had a spiritual awakening that night. So can you talk about holistic recovery? What that looks like for people?
Oh gosh, yes. I'm a recovery coach for Recovery 2.0, which is a very holistic recovery platform. And I was attracted to it because already I had a little science background, so I understood nutrition and the value of it. I have had a meditation practice since like 1975 or something.
Oh,
So
wow.
I understood the value of meditation. I think was one of the things, along with some other factors that I feel got me through those 4 years on chronic pain, was that all that meditation that I had, a meditation
Yeah.
practice, very helpful. Recovery 2.0 looks at, we also work we include the 12 steps. That's all part of it, but we also include nutrition and yoga, which is this spiritual practice, and and community, right? So we've got these pieces and then also on that platform, I think there's about 75 coaches that Tommy Rosen runs that platform. He's been, I don't know, 30 years in recovery, he's a long time in recovery.
Mm-hmm.
And I think he's trained, I don't know, 40 or 50 of us at this point, maybe 60. I can't remember how many exactly, but he's got a group of recovery coaches that people on the platform could get access to. They don't work for R2O. They've been trained by them. So there's kind of a difference there, but,
Mm-hmm.
and he brings in speakers from all over, bring their wisdom around recovery. It's a very rich platform. We have meetings. We've got over 30 meetings a week, over online, within the community, that are all these different, all different ways. The thing I like about R2O, Recovery 2.0, is that it has all addictions are welcome. So it doesn't matter, it could be food related, it could be drug related, it could be alcohol, it could be relationship issues, sex, love addiction,
Mm-hmm.
codependency, whatever the thing is.
Yeah.
It's all this dis-ease of disconnection.
Yeah.
It's just a matter of kind of like, how are we coping with that? Addiction is really a coping strategy for this disconnection thing. It's just an unhealthy way of trying to find safety in the world when we're in this space. So the holistic view is we get clean, we stay clean, like we stay sober, and we find a sponsor, someone to support us. We get into recovery community, so that we're around other people that are working that. So we have support, and we can share experience, strength, and hope. What's working, what isn't, kind of stuff. Maybe we're in therapy. Maybe we've got a therapist. If we've got a trauma background, we're in therapy. Maybe we're in physical therapy.
Mm-hmm.
In my case, I brought in Dr. Peter Prescott taught us Qigong. I wasn't well enough to actually do yoga. The yoga that they offered at the treatment center I went to was too vigorous for me.
Mm-hmm.
They could have brought in just stretching yin yoga, but they didn't. They brought in vinyasa, which was like, I couldn't even do that at that point. But his Qigong was very easy, very accessible, and I could do that. And that's very clearing as well. So Qigong is a beautiful Tai Chi would be another one that's very
Mm-hmm.
helpful. So you're wanting to do some kind of focused movement that helps the body, the nervous system, begin to unwind all that tension, realign, and come back to yourself. Bring yourself to the present moment. In addiction, we're in the past or the future, but we're not here.
Mm-hmm.
We have an argument with the present moment in addiction. We don't like the way things are showing up in this moment, so we try and do something. Do we chase the next moment, or we try and do something to change the moment? We're having an argument with the present moment. So all these practices, yoga, qigong, tai chi, all those, they bring us into the present moment. And when we come into the present moment, we can begin to, and when we bring in the breath, we begin to relax. And then we can begin to connect back to ourselves.
Mm-hmm.
And we find, oh, home is here. I don't have to go searching for it out there. It's right here, right? And that's this huge turning point, which I think your son and you probably experienced that, the way that you were finding your way, you found your way back home. I'm
Yeah.
not sure if you did it through yoga, but you did it somehow. you, you must have done some kind of a holistic program. You can't sit and eat a lot of sugar if you're now, even if it doesn't matter if you're coming off opiates, if you're a food, if you're coming off alcohol, and you have the sugar habit, you're not going to calm your nervous system because that just jazzes you up more.
Right. Yeah. Well, I was addicted to saving my son. That was my addiction. And he became my drug of choice. And
Yeah.
when I had hit my enough, I talked about this in other podcasts. Someone gave me this book, Asking It Is Given by Esther and Jerry Hicks.
Hmm.
And I just couldn't get into it. I just was like, "Oh, I don't want to read anything. I'm sick of reading. I'm sick of reading about codependency and all this stuff." And so this woman said, "Well, go to page 36." And when I did, it was an emotional scale. And I saw it was 1 to 22, and I was number 22. I was full of despair. I was depressed. I was a mess. I was an emotional mess. And it slapped me in the face and said, "This is who you are today. And that's not who I am."
Mm.
And so I worked so hard to get myself I keep myself between 1 and 7. If I get to number 8, which is boredom, all bets are off that I'm not going to vibrate back down and have anger, have all kinds of negative stuff. So I really worked hard at that. So I went from 22, and I think number 17 was anger. So I took a pillow and I beat the crap out of my bed. I let it out. And so that was part of it. And then I started journaling. I made myself do a gratitude journal. Every morning I had to write something I was grateful for. And back then I was so pathetic. I'd be like, "Okay, I'm grateful because I opened my eyes today." And I didn't mean anything I was saying, but I made myself do it. You had to get out of bed and you had to write one thing. And before I knew it, I was writing paragraphs about what I was grateful for. I started to look past being addicted to saving him. And I started to go on the spiritual journey. I went on like meetup.com and I found some spiritual meetings that were local. And I'm a kind of a shy person, but I made myself go. And I started meeting people, and it just took on a life of its own. I had no intentions of doing anything but being my boy's mother, my husband's wife, and selling real estate. That's what I did. And now I have this business called Sharing Without Shame and a podcast called Sharing Without Shame. And it all happened organically and holistically.
Beautiful.
Yeah.
Beautiful.
Yeah. It's just crazy. So through all that you've been through, I mean, part of your yoga and all of that was early on, but you became a recovery coach, and the turn of events that took you from where you were to where you are today. You're helping other people. I believe you're an author. And what is your book?
Oh, it's The Way Through Chronic Pain. Tools to Reclaim Your Healing Power.
And where can people get that?
Or you can get it on Amazon, or you can get it on my website, which is Elizabeth-Kipp.com is my website. Got to put a hyphen between my first and last name.
KIPP.
KIPP, like Peter Pan. Yeah. So here's the thing, though. When I was in treatment, you talk about where I was and where I do today. When I was in treatment, there were 100 patients on campus, and 80 of them went to relapse school in the afternoon, and the other 20 went to pain track. And I was in the pain management program, so I went to pain track. And I asked my counselor, everybody's got a counselor. I asked my counselor, well, I'm not getting any training in relapse. All right. So what do I do about that? Because I'm always going to pain track. And she said, which I needed and I loved, but whatever. And she said, oh, there's an 80% relapse rate in the first year. And I was like, I don't like those odds. I thought to myself, oh, well, I'm doomed. All right. Because the odds. And the second thing I thought was, well, hang on. What's wrong with the model, the recovery model we're using, if the best we can do is an 80% relapse rate? Mm. So I dedicated myself in that moment. I committed myself to, when I got out and got my sea legs of my own recovery, that I would dedicate my life to helping move that needle and reducing the rebound. And that's what I'm doing. Yeah, that's what I do.
Because it needs to be. It needs to get better. And, things have changed. And I think the stigma, it's still there, but it's not as bad as it was when I was dealing with my son in the late 1990s and early 2000s. You didn't talk about it like you can today. And, people are finding their support, their network on social media. I mean, it's been a huge way for some people to get help, especially the younger generations, because they're not so keen, from what I'm hearing, to go to meetings so much. They like the social media piece of it.
Mm-hmm. Well, the Alcoholics Anonymous and Narcotics Anonymous have been, especially Alcoholics Anonymous, just started all of it, all the meetings.
Yeah,
has been phenomenal in kind of getting the movement started and have saved countless lives with their program. Absolutely. Narcotics Anonymous came along about 50 years later, and they've filled that niche. The thing about that, though, which was one of the things that attracted me to your program, to your podcast, was the anonymous programs, Alcoholics Anonymous, Coda Anonymous, right, Al-Anon, all of it. All the anonymous programs, they're anonymous. So we're meeting in the basements of, it's metaphorical and actual, basements of churches, and but not in the main section. And one of the foundational principles, one of the traditions is we maintain anonymity. Mm-hmm. So my question when I got into that space, and this is who I am, my question, I honor that practice. And you notice I'm not anonymous. I don't understand how we can solve the problem in society if the problem remains hidden. Alcoholics Anonymous, one of the kind of mantras which is the truth, our secrets keep us sick.
Absolutely.
So if we're keeping secrets about addiction and our recovery, trying to recover from addiction, if we're keeping that secret within society, how is society going to get better? How are we going to solve the problem of addiction if we keep hiding it?
Right. Yeah, because some people are still living in fear that if they say, I have I'm in recovery from whatever, that they could lose their health insurance or possibly lose their jobs, or because of the stigma. And I hope that it's not like that anymore. But I work with a nonprofit, and we oversee all the recovery community centers in New Hampshire. And so we deal with a lot of younger people, and they're not going to the meetings because they don't want to be labeled for the rest of their lives that they're, and I don't like these words, addict and alcoholic, because to me, you see the person first. That's not who they are. Right? Exactly. Yeah. That's just a label that was given to them that, in my opinion, needs to go away. You could say your name, and I'm a person who has a substance use disorder, or I'm in long-term recovery from.
Sure.
But your addiction is not who you are.
Exactly.
And I think that's the, one of the problems, that the younger people are moving past it and go, you know what? I'm not going to stay sick. I'm going to go live my life, and I'm going to, they'll find a way. This woman, and she does it through yoga, and she does some beautiful stuff, sound baths, and and that's her recovery program. That's how she works, doing it holistically.
Mm-hmm. Yes, and she's probably in some kind of community. It may not be a 12-step community per se, or it may not be and anonymous, like R2O is not anonymous. We are who we are. We're not
Yeah.
anonymous. We respect all those other organizations. That's just not how we're just different.
Yeah, absolutely. Because you know what? Without them, so many people
Oh,
wouldn't be well.
yeah,
And so,
absolutely. Yeah,
yeah,
we understand the roots and how important it is, and we're just a different iteration. It's just, however you can find recovery, find it.
there's many pathways, and it doesn't matter what your pathway is as long as you find the pathway that works for you.
Yes. Yeah, and I just, for me, it just the integrated model it seemed logical. I had to
Hmm.
hit the problem on all levels, physical, mental, and spiritual. I had to hit it. I had to hit all the keys there in order to solve the problem. I just didn't realize when I was on the medication and in the throes of chronic pain, I didn't realize how pervasive the problem was. I kept thinking it was just my back because that's what the doctors kept pointing to.
Hmm.
and they and it wasn't until I met Peter Prescott, Dr. Peter Prescott, that I started to wait a minute. This is a full mind, body, spirit problem that
Yeah.
that we've got to solve, right? This is a whole malady on so many levels,
Hmm.
right? So that's why I have chosen the path I've chosen. But there are many paths, and we need to find the path that works for us.
Well, and that's part of the holistic healing, correct? That you look at the body, mind, and soul, where like Western medicine, they look at the symptom.
Yeah, they're looking at the physical.
Yeah.
They're looking at they're looking at the symptom, and they're not looking at the root cause of the symptom.
Hmm.
Sometimes they do, but not always. Yeah.
Yeah, I think there. Yeah, I think some of the. My husband and I found this new doctor, and he's really cool because he's not pushing meds because we're not a medication. We don't do medications and stuff, and we like the holistic stuff. And even though he's not holistic, but he's really open to listening to the us and look at the whole person instead of just the symptom. And I really appreciate that because I think that's really really important.
I agree, and I'm not going to put down medications. It's just a bigger hammer. So the question is, when is the bigger hammer method appropriate? it's it's not. We don't pick up the biggest hammer in the room just because when we have a little tiny nail or
Yeah,
whatever. It's kind of a metaphor for
yeah, yeah. We
drugs are
just
kind of a
start smashing.
heavy hitter, and sometimes they hit the problem and sometimes they don't. It kind of depends on the problem, and it
Mm,
depends on how long the drug is in the system. Like we talked about, opiates good for acute pain, but not so much for chronic pain.
right. So as we wind down, what words of wisdom would you like to leave the listeners with?
Oh, well, I would say that there's always help. Please ask for help.
Mm,
Like if you are listening to this and you're like, well, I don't know how to deal with this problem. I don't care what the problem is. Ask for help. Dig into your courage and ask for help. And don't allow shame to smother your voice in asking for help. One of the things one of my teachers in the recovery space says, shame is the food of addiction. We have to shine the light on it wherever it's hiding.
I like that. And in the negative self-talk, to not listen to that, right? That, that's part of the problem with the shame and the blame. And
Mhm.
so to stop that from happening can be
Right.
hugely important.
This is where yoga comes into meditation, and yogic practices come into play in the present moment and the breath, because you need to divert your attention when that negative voice, because it's a negative thinking is a chronic pain, is another addictive thing, right?
Mm,
So,
hmm.
and I had a heck of a chronic of a negative mind when I came one of my drugs. I detoxed off those drugs when I have massive negative thinking problem. So habit, right? So
Mm.
this is where yoga was so helpful. I mean, I had therapy and other things I did. I did ancestral clearing. I did a bunch of other things too. But the yogic practices are very helpful at clearing the negative mind. Yeah.
What's the ancestral clearing? You want to
Ancestral
talk about
clearing
that?
is a registered and trademarked healing modality that Howard Wills pioneered and John Newton of Health Beyond Belief registered, trademarked, and teaches. I'm one of his practitioners. It's a beautiful healing modality, and it's kind of energy medicine kind of healing modality that helps us clear the negative imprints of the past. Not just in our past, but in past generations, like information that comes into the system, like worry energy and scarcity stuff, and vendetta energy that might be in the lineage, that kind of stuff. When I am finished with this, my next thing today is to do an ancestral clearing session for somebody in recovery. So,
oh wow, cool. Yeah, because if we don't clear all that, and a lot of people may not understand that all the generations pile up on us. And it's some of, like my parents were from the silent generation. You didn't talk about anything. You kept it quiet. I'm a baby boomer. Yeah, we kept our secrets, but we started to come out a little bit. And then the parents before, all that kind of trickles down until somebody says, I'm not participating in this anymore, and I'm going to heal all of this, and I'm going to work on taking care of me and undoing some of that programming.
Yeah.
So anybody, if anybody would like, you offer one-on-one and group sessions for stress and chronic pain management and addiction recovery. And your book, again, is The Way Through Chronic Pain, Tools to Reclaim Your Healing Power. And if you would like to get in touch with Elizabeth, you can reach her at Elizabeth-Kipp.com. Thank you. Thank you for your time. This was wonderful.
Oh, thank you so much, Donna. It was a great conversation. Appreciate your platform.
Thank you for tuning in. If you'd like to support the Sharing Without Shame podcast, please subscribe, like, and leave a review. If you're in need of emotional support, Donna offers private sessions. For more information about Donna and the services she offers, visit www.sharingwithoutshame.com or email her at Donna4support@comcast.net. Nothing in the Sharing Without Shame podcast is intended to establish a therapist-patient relationship or intended to replace the services of a trained therapist, doctor, or health professional, or substitute for professional mental health, medical advice, diagnosis, or treatment. Until next time, may your faith and strength heal your heart.